Let's create one of my favorite tattoos, a 3D areola tattoo for those that have survived breast cancer and mastectomy or had top surgery after gender transition care. I start with taking a single or a 3-round liner needle, and I take one of my medium to darkest colors to create the nipple seam. I'm going to create an imperfect circle and then clean out the cartridge with any remaining pigment by just shading the bottom, because that's where we want the darkest shadow to be, where the light is obstructed if the 3D areola and nipple are truly lifelike and sticking up and out off of the flat skin or 2D surface like we've got here on our latex practice pad. Next, I'm going to take either a 13 or a 15 curved magnum. I have a 13 curved magnum here, and I'm going to start shading in slow and soft circles at almost a 45 to 60 degree angle to create a soft, shadowy areola shape and color in the skin. You don't want a perfect circle. You don't want a perfectly solid, saturated color. You want it to be a little bit darker in some areas, especially towards the bottom, and lighter towards the top, because that's not only going to create the 3D realism of skin, but it's also going to help you create some areas where it looks like there's creases in the skin and there's movement, which we'll show and talk about a little bit later. After I shade in the areola with 1 to 2 either light nude colors or darker nude colors, depending on the type of client that we're working in, this would be a Fitzpatrick 2 or 3. We are going to begin with that single or 3-round liner and begin shading the center of the nipple. Now, I'm using a medium pink color here, and you can see I'm just lightly whip shading, or you'll use pointillism if you're a newer artist, to shade in the nipple. And then I'm going to come back in with a darker reddish pink color and really try to blend those two colors together, not only so that it looks like it's real nipple tissue, but you want to truly make it look like there is a shadow, so that nipple is sticking up and out off of that flat surface.
What are you grumping at him? He did not deserve no grumping from you. Alexa, next.
Now, in order to create some movement in the areola, we want to create our constriction lines or our creases in the skin. So I'm going to go and start adding some lines in our medium pink color, and I'm just looking for the areas in that areola shading where it already looks like there's some lighter and darker areas of shading, and I'm just trying to exaggerate that by adding these constriction lines. Most people are going to have these wrinkles on the skin because when they get cold, the skin is going to contract, and when they get excited, the skin is going to expand.
Alexa, next. Alexa.
Next, I'm going to take a medium brown color, and I want to use it to just outline the bottom of that nipple a little more strongly. So again, it looks like that shadow creates the appearance that the nipple is sticking up and out. And then I'm going to go in and just lightly shade down beneath the nipple so that it creates that cast shadow. And I don't want to do this too heavily, especially because we have a lighter skin toned areola, but I just want to do it enough so again it looks like when the nipple is sticking up and out, it's blocking the light from around it. That's what creates our 3D areola realism. Many clients will have what's called areola or Montgomery glands on the surface of the breast or chest tissue. These are sebaceous oil glands that are normal, but not every client has them. If the client doesn't have them, I don't add them. If they do, I like to take some of those 2 different medium pink colors that we used for the nipple, and I just want to use stippling or pointillism to create these little tiny areas, these cups of shadow in the skin, again, exaggerating the areas of light and dark that we've already created with our shading earlier on. And I want to create these little areas of movement where it looks like there's little lumps and bumps in the skin, because this to me is what truly creates our realism and makes it look anatomically realistic for the client. The final step to any 3D areola tattoo is going to be adding white. So I'm going to switch to a brand new needle, and I'm going to use our pointillism technique to just dab that white into those little cups that we created. And then I'm going to go in and I'm going to start highlighting the nipple. Most light sources in a room are coming from either the ceiling or high on a lamp. So you want the majority of the white to be towards the top center of the nipple. And again, you want to exaggerate that shadow towards the bottom, because that's what makes the 3D realism. And you can see that now as you see the white developing. It should look like that nipple is sticking up and out off the flat surface of the latex by how we've shaded our areas of light and dark, shadow and highlight.
No. No. Alexa, play Northern Exposure by Noah Kahan. Alexa, play Northern Exposure by Noah Kahan on Pandora. Alexa, play Today's Hits Radio on Pandora.
The final step is going to be taking our white and highlighting around our creases for our constriction lines. Again, if there is a shadow, there should be some highlight, which is going to make it look like there is movement on the skin tissue. And so I'm just going in and highlighting those creases to make it look like the tissue is actually raising up off of that latex pad. Here's our finished result. If you want to see this live, I go live every single day on TikTok at PMUGoo, usually between 7 and 8 a.m., where you can ask questions and learn along with me. Follow along for more 3D realism tattoo.
Oh my goodness, that's crazy.
Position. Rounder, just a